testify in support of HB 2612 on behalf of the Texas Psychological Association, as well as myself. I'm a licensed pediatric psychologist, a licensed specialist in school psychology, and I have more than 20 years of experience working with medically fragile children and their families. In over 2 decades of service to my community and the public schools, I've never encountered anything like COVID-19 and the series of events, both big and small, with which our society has been forced to deal. Young and old alike have been experiencing constant anxiety and fear based on the unpredictable nature of what lies ahead. In mental health circles, we call this acute on chronic trauma, and it will invariably create a ripple effect of mental health issues for years to come. Nevertheless, one undeniable positive that has come about secondary to the current pandemic is the proliferation of virtual medical and mental health services now available. Between barriers to access, long wait times, and the stigma attached to receiving mental health services, Texas has historically lagged behind the entire country with respect to the number of mental health providers available to serve those in need. Telehealth services have meaningfully addressed these limitations rapidly and comprehensively, while first and foremost, triaging the needs of underserved rural families struggling with mental health issues. HB 2612 is designed to serve many simultaneous functions. It would retain provider flexibilities initiated during the COVID-19 pandemic to ensure that Texans can continue receiving consistent access to much needed mental health and substance use treatment. It would require that reimbursement for telemedicine and telehealth services be at the same rate as in-person within Medicaid and CHIP, helping to keep providers' practices financially sustainable over time. It would ensure that a reimbursement request may not be denied solely because an in-person service between a healthcare provider and a patient did not occur, challenging the outdated notion that a provider can only treat a person in person. And it would protect platform choice to ensure providers have flexibility for how they deliver telehealth and telemedicine services, granting patients outright control of the service model. Watching waitlists for mental health services balloon over the past year has been daunting, but another statistic many of us have tracked carefully has been our no-show rate, and this benchmark has plummeted. Patients are attending their appointments at unprecedented volumes because 1, they're experiencing significant levels of distress, we know this, and 2, the virtual medium has essentially eliminated historical barriers to ensuring that patients and providers are receiving the support they need to continue improving their quality of life. Thank you for your consideration and for allowing me to speak on behalf of the Texas Psychological Association in support of HB 2612.